Do you envision this becoming more in-house, the AI and the patient decision-making tools and those clinical supports and the workflow automation? Do you think that's going to start to land in that ballpark of the EMRs? Like, because it's going to be
Yeah.
very difficult, again, with the heterogeneity of the different
Yeah.
EMRs for these AI companies to integrate. Like,
Yeah.
for a market as small as Canada, that's going to be a challenging
Yeah.
trade-off. Do you think the EMRs are going to start doing it all in-house? Or I guess to put it another way, in the States, do you know if this is all already happening within a single EMR because they just have the power to do so?
Yeah. So I think the States is a very different beast. Be- so it is happening in their HIS systems, right? So Epic, Cerner, Meditech. So a lot of this is already happening in the States in terms of Epic, and it's starting here also for the hospitals. And in the States, it's the Epic modules that are traditionally in the community. Like this concept, I mean, not everywhere, but most places, this concept of having whatever EMR you want and having so many to choose from in the community that doesn't talk to the hospital, doesn't talk to each other, that's very much a Canadian problem, or other countries too, but that's a Canadian problem, right? So I do think in the States it is happening because the vendors it's tighter, it's smaller, and they have a whole different focus on where their resources and money go, right? Here, I think I think this is where we have to be careful, right? Because we want to be independent of the vendors, right? So that means the vendors need to open up their APIs and so that companies can compete and innovate. Because right now, Canada, what I've heard from a lot of companies is that this is not an innovative market for them. Like they build all this and then they can't get it into an EMR. And if it's not integrated into an EMR, then docs won't get it. And then if it costs too much, docs won't get it. So then they go to the States because that's where their market is. So I do think we need to look at ways that we can start kind of opening APIs from vendors, or is there a way that the government can step in? It has to happen from a regulation legislation point of view, because I don't think it's not going to happen with you and me, like our organizations or family docs or anyone saying it. I think it has to happen from a top down point of view. But if they're able to open that up and make it a lot easier to use these new innovations, then I think it doesn't matter if it's vendor dependent, because then you would just pick what works for you. Until that happens, though, right now it is very much in-house. And I do think vendors are looking at, I mean, I think they would not be prudent if they weren't looking at this, right?
Hmm.
Like, there's a lot of work being done in that field.
Is anybody currently looking at that or advocating that, in terms of that just regulation standpoint? Because when you look at
Yeah,
it from, TELUS's perspective or
yeah,
whoever, they've got their walled garden. Why open it up? Why make it
yeah,
easier?
yeah. Well, I think part of it is it is their business, like like it is their business, right? But I think it's not that they don't want to open it up. Sometimes I think it's the technology doesn't talk to each other, right?
Hmm.
And they may not want to put that effort into it, or they're worried about their privacy and security, because when you open it up, now you're opening up all our PHI, our EMR, and all our data. Like, so
There
I
doesn't
think
seem to be a
there's,
lot of incentive for them to make those changes unless there was a regulation piece that came
yeah,
from the top.
yeah. I do think so. I think there's two sides to every story, but yes, I do think it has to be from a regulation point of view if we're truly going to start looking at innovation. I do think the kind of health info way is kind of the federal digital health arm, um, and Canadian Medical Association. I think these are conversations that they're having in terms of data out, right?
Hmm.
Like, how do we get data out of EMRs? How do we get EMRs talking to each other? How do we get coding and standards? So these conversations are happening. They're also happening in the provincial level, where they're saying, well, how do we do all this so that the vendors are able to do this in the background? So it doesn't put burden on physicians, but it doesn't put extra cost on physicians, but it becomes just, you have to do it. So those conversations are happening. But I think those conversations have to be decided at a much higher level than us.
It's tough, right? And I think that's a big part of why the AI scribes have become so popular, like almost overnight, it seems, right? Because
Yeah,
it's
it's
EMR
easy.
agnostic and you can use the tool
Yeah,
anywhere.
yeah, and it meets the need, right? Like
Hugely, hugely.
our early studies are saying that you're saving 4 minutes per visit. And, that's like an hour and a half, almost 2 hours by the end of the day, right? Like it meets the need. Like that's your biggest burnout point. And you've got this technology, like you said, it's not in the EMR. Anyone can use it and it meets the need. I mean, it's not perfect. It doesn't meet everyone's need, but it meets a lot of the needs.
We're getting there. We're getting there.
We're
It's
getting there.
definitely like a very big, shiny beacon of hope amidst the burnout and
I
admin burden.
know. I know. Yeah, I've heard that from so many docs who have already started using it. They're just like, I was going to quit. I was going to quit like probably by the summer, but now I think I got a couple of more years in me. And that's really powerful when you have a tool that's actually going to extend your working for another 2-3 years. So your patients still have a family doctor, which is why I think that scale and spread is so important, right? Like it shouldn't be up to us in the community to be funding this so that we will stay there longer. Like this should be something that's funded by government or outside of us because it's actually helping the health system as a whole. And the cost is not insignificant, right? Like it ranges, but it could be up to $250 a month, $300 a month. Like that's a lot of money when we're paying, like it's doubling our cost for the EMR, and it's only just one AI scribe. Like what happens when it's AI inbox and everything else?
I think the DAX software from Nuance Microsoft, that one was like $600 a month, even for the Cadillac of AI scribes. It's crazy how much
Yeah,
extra, but I've never tried that one. Perhaps it's
no.
worth it, and it's just such a
Oh,
smooth ride. I don't know.
for $600, you should like see all my patients and bring me a coffee while I sit in the back. Like, that's a lot of money
No
because
doubt.
you're also comparing it to like a physician assistant or a human scribe, right?
Yep.
So one of our peer leaders who've done excellent work on human scribes and had developed a bit of a training program around it is kind of looking at AI scribes and human scribes because and physician assistants and using staff better and kind of making a mix of it because there's still stuff that the AI cannot do that if you just had a human next to you doing it, that would probably save you much more time, right? And effort and like so you don't want to jump on the AI bandwagon because you want to kind of step back and look at everything, which is why I kind of always say go back to your needs assessment, right? So I mean, digital health such a I don't know, people don't get excited about it, as you know, and no one wants to hear that you have to do something methodically. But basically, you need to look at your workflow, right? So you need to map it out. So this is my people get tired of hearing me saying this, but you need to get a giant piece of craft paper, some Sharpies and Post-its, and you just map up your workflow and you put it in the kitchen in your office. And if you've got staff that can help, they add in where things are bottlenecking, why it doesn't work for them. And then you kind of figure out where the solution is. So AI scribe might be the solution, but maybe you're someone who uses your EMR really well. You've got templates, you've got custom forms, you've got stamps. You already have developed some sort of algorithm. You use e-forms that you send out to patients that auto-populate. Maybe you don't need scribe because your chart is already done, right? So maybe you don't need to jump on the scribe bandwagon. Maybe what you do is you look for a technology that helps more on the front end of things, right? But you're not going to know that until you map it out, look at your needs, and then figure out what you need, right? In terms of the pros and the cons, and then picking the right technology.
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.